Hey, Jim Hoffman here for EMS Office Hours, and this is your Monday Minutes. Today, we'll talk a little bit about vital signs, guys, and particularly focusing a little bit on pediatrics. Now, pediatrics are one of those patient types that we get, and there's a little bit of a stress factor that goes on when we have these patients, right? There's an elevated stress level from the parents, from other family members, yourself, maybe even your partner, and of course, the patient themselves. You're a stranger, you're looking at them, you're touching them with things like, the blood pressure cuff, the stethoscope, pen lights, and your physical exam, and it's frightening to the patient. So vital signs are something with the pediatric patient that it's good to kind of know what ranges you're looking for when you are assessing the patient. The problem is that there are a lot of varied ranges with pediatrics, and it can be both weight and age dependent. But just keep in mind that your pediatric assessment and how you find the patient and how you're going to treat the patient does not always depend upon the vital signs alone. Most of us know you should be aware that pediatric patients, of course, the vital signs may present to you as fairly within a normal range for that patient, right? So what we have to look at more, of course, are things like their overall appearance and their mental status. If they're unable to talk, are they lethargic? Are they sleepy? Are they agitated? Do they not seem to care that you're there? Now think about that for a second. The pediatric patient that you're assessing as a stranger, and they don't really care if you're there or not, right? Keep all of this in your mind when you're assessing your patient, and don't just focus on the vital signs. But with that said, we do still have to make sure that we evaluate the pediatric patient's vital signs, their blood pressure, their heart rate, their respiratory rate. And these days, there's a lot of tools out there that we can use to help us do this, right? Because we can't remember all these wide ranges based on a patient's age or their weight or even their height, right? So we have apps available to us. There's iPhone apps out there. There's apps for the Droid, other smartphones, iPads and tablets like that, and also web-based apps as well. Apps you can go ahead and just find online on a website and look at your ranges there as well if you don't have an app on your phone or you don't have ability to get apps on your phone, right? Other things are things like guides. There's pocket cards you can get, right? These are pocket cards that you can make on your own. Find some images, make your own pocket card, print it out, and keep it in your pocket to refer to, right? What about field guides? That's another thing you can use. A lot of great field guides out there that you can go ahead and get that are pocket guides that will have, of course, much more than just the pediatric, vital signs guidelines, but a lot of other information as well. InfoMed comes to mind as one of the more popular sort of field guides out there, and InfoMed, of course, has their app versions as well. And then, of course, we have the Broselow tape that you can use, and something called the PD wheel as well. Some of you might be familiar with that device as well. And these are physical type devices. And going back to the phone, guys, if you don't want to have an app on your phone specifically for a pediatric guidelines, it's very easy just to create an image, okay, like I mentioned, and actually just upload it to your phone and keep it on your wallpaper, okay, on whatever page you might use on your phone for EMS. I myself have a page on my phone that is all my EMS apps, right? My guides, my phone numbers, all the good stuff that I use on a daily basis. But if I wanted to, I could just simply make a picture, create a graphic, and put it on my phone. So this way I don't have to go into an app and look for it. I can just click on the image. The image will come up and give me the overall vital signs ranges for patients. So look at something like this here. You can easily create something like this, make it into an image. Okay, most of us have Microsoft Picture Manager on your computer. You can go ahead and create something like this and save it as a JPEG or a GIF sort of file type. and take an image like this and put it on your phone. And this way it'll be on your homepage. You can just click on the image itself and it'll just bring up the image and give you the basic normal ranges for pediatric vital signs. Now, if you look here, again, we mentioned before all the different ranges. Look at all the different age groups here that they have that they're trying to focus on, right? 1 to 12 months, 1 to 3 years, 3 to 5 years, all this type of stuff that you have to look into, right? But now if you look here at the weights, 2 to 3 kilograms, right? But if you go to 4 to 10 kilograms, you've got a different vital signs range. So perhaps your toddler that's, a little bit, 1-year-old toddler might not be 10 to 14 kilograms. Maybe they're falling along the lines of an 8-kilogram patient. So you have to keep in mind that these numbers are not set in stone. It might go ahead and be adjusted depending upon the weight as well. So keep that in mind when you're using tools like this. Okay. The other thing I mentioned is the Broselow tape. I got this from a friend of mine, Rogue Medic. He got this photo from this link here below. It's an FDA.gov site, but this is just an idea of the Broselow tape where you would lay the tape next to the child and determine their zone, right? And your zone is the pink, red, purple, yellow, white, blue, orange, green, right? And these are the weights. And then according to that weight in that zone, they give you everything from vital signs to drug dosages to endotracheal tube sizes, all this type of stuff. And again, not set in stone. These are guidelines, right, to put you on the right track to where you need to be. Now, if you look at something like this here, this is a kit that they have where you've got the Broselow tape, and then each individual color area, you've got a little mini sort of pouch here, right, that corresponds to the color of the Broselow tape. So if your patient, let's say, is a yellow, falls within the yellow guidelines, then in theory, everything you need to treat that patient under the yellow guidelines will be in this yellow pouch here. Okay, makes it easier. And again, you think about the stress levels, you're thinking about everything going on with a critical patient, critical pediatric patient, when you're going to be doing procedures, using equipment, using drugs, and having something like this can cut down on time and cut down a little bit, I think, as well on stress. Of course, there's a cost factor involved with something like this because now your agency has to sort of duplicate some of this content that's inside these individual pouches here, right? And of course, you have to concern yourself with expired drugs and expired equipment that doesn't get used that much. And when they're in these individual pouches, it's very easy to sort of forget to check or overlook an expired medication or expired piece of equipment. Okay, so all that has to kind of go into your thought process if you implement something like this. But it is a great way to sort of compartmentalize individual colors that correspond to the Broselow tape and allow you to cut down on stress a little bit and cut down on when you're looking for that drug or that size equipment when it comes to the pediatric patient and where you might find them on the Broselow tape. The last thing, again, just a quick picture here of the PD wheel. This is, of course, smaller. It's easier to carry because it's not as a big tape like the Broselow tape. And you have on the outside here, you've got ages. And as you turn this wheel, it's going to give you, in the middle here, it'll give you the guidelines for pulse rate, for systolic blood pressure, for respiratory rate, endotracheal tube size. Okay, so all that good stuff. So a little more concise, a little easier to carry. You can get this at the EMSwebstore.com, Amazon.com, Boundtree, More Medical. All these great places have this PD wheel. You can go ahead and get that. It's for sale. The bottom line, guys, use what works for you. And I always tell people this, that it doesn't matter what your instructor says, what your preceptor says, what your partner says. You've got to find the device, whether it's an app, whether it's just a picture, whether it's a small piece of paper you keep in your pocket. Whatever works for you, whatever is going to help you treat these patients and keep you as a provider on track to do what you need to do for that patient, okay? If you're the type of person that gets very stressed with pediatric calls, maybe you want something more involved like an app. If you're the type of person that doesn't really get too rattled with these types of calls, but you want to have a little piece of paper in your pocket or a little index card giving you these vital signs just to kind of refresh your memory, do that. Whatever works for you is what you should try to use as an EMS provider. Don't get locked in to what everybody else is doing. Try to find what works for you. You might have to try the PD wheel, maybe it doesn't work, and then go to an index card. Then if that doesn't work, maybe try the app until you find something that you find fits your style and your method of how you're assessing your patients and how you're treating them and your stress levels. Okay, so just keep all that stuff in mind, guys. So listen, if you're interested, I actually did a Pediatric Assessment Essentials webinar with Greg Fries a little while back, and this was a recorded webinar that we conducted. It's a little bit over an hour long, and it goes over the importance of pediatric injury and prevention and how EMS plays that role. It's very brief on that, but it really kind of focuses more on forming a general impression of your patient, how that whole toe to head sort of technique you can use are great in assessing the patient from afar. Like I mentioned, the patient's general appearance, and how these are all key components to your initial assessment. Okay, think about age-appropriate communication is going to show you, assessment of vital signs and pain recognition, which is also very important for the pediatric patient, and performing procedures on pediatric patients, and thinking about the challenges that we come in contact with, guys, the EMS provider, when you are splinting or immobilizing a pediatric, right? Think about the last time you had to spinal immobilize a young child and how they might have fought you and thrashed around, and how much good that was really doing for them when it came to immobilization if they were fighting you the entire way. Now, I have a link here that goes directly to the webinar page. There is a small cost, guys, for this webinar. It's about $7, but you get access to everything there, including the audio version of the webinar as well. You can download to your MP3 player and go ahead and listen to it that way as well. So this is a kind of a long link. You can copy it here. I also have it in the notes as well, so you can go ahead and just click on it there. Okay, so hopefully you can use these Monday Minutes, guys, and maybe give you some thoughts and some ideas on how you can go ahead and keep on track with your pediatric patients and assessing them and their vital signs, and how to kind of tie it all in together a little bit. If you have some minutes of your own, be sure to send them over to me. My new email address is admin, ADMIN, at emsseo.com, and I'll be more than happy to try to create a Monday Minutes, guys, based on something that you're interested in, and get it up here on YouTube and over on the blog at emsofficehours.com. Guys, until next week, as always, Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.